you are approaching a patient who has chronic lower back pain, and if you don't understand, just let me know so that I can also explain. So while you are examining a patient, you first need to expose the patient back, and then you would like to inspect the lower back. From the front, you will see that there is no bulging, there are no stiffness, or there is no structural deformity, there are no rashes, and you will inspect it from here, then you will inspect it from sideways so that you don't miss anything. If you miss any structural deformity, so that you make sure that there is nothing present here on the lower back pain. So that's the inspection. Then you started off with the palpation. In the palpation, you will start off palpating the spine. So you make sure that there is no tenderness in the spine. Alright. And then you also would like to see, is there any paraspinal spasm, so that lower back pain due to musculoskeletal problems could be ruled out. Okay, so once you're done with your palpation of the lower back pain, then you ask the patient to, can you please lie down? Thank you. Okay, then you ask the patient to do SLR. Can you raise your leg straight? Yes, up. Good. Can you raise your leg up? Okay. While you ask the patient to raising up, you then flex the knee, and then you do internal rotation, external rotation, and actually this is an external rotation. This is an internal rotation on the hip joint. Okay, and then you put it like this. Can you flip yourself to me? Yes. Okay, and then you make sure that there is no. Then you ask the patient to extend it, so there is extension in the hip joint. Thank you. Can you do it the same supine position? Thank you. If you are asking the patient to do SLR, and you did an SLR, and then there is a pain, and the patient says that there is pain, then you ask the patient, where is the pain? And the patient says that pain is here, over doctor. The patient, this SLR is positive or negative? It's a negative sign. The positive SLR or a true SLR is that the patient feels pain here or here. This is the lumbar region. The purpose of doing SLR is what? Disc herniation and compression. But what is it compressing? Radiculopathy, but which nerve? Sciatica. Okay. So the patient has sciatica problem, and whenever he has pain going upward, he will have pain. He should have pain here, not here. This pain is just a stretching. It's not for the sciatica problem. The sciatica, okay. If the patient has pain, the pain is going from lower back pain and is coming down to the thigh or down to the calf muscles. If the pain is starting from here and going through and through to the back, then this is sciatica. If the pain is originating from the lower back pain and it is coming up in front, this which nerve is compressing? Femoral nerve. Okay. So on the basis of history taking, you should know that which nerve is actually compressing, which is causing a lower back pain. So the patient is having pain going through and through back, sciatica, from back to front, femoral nerve. And you obviously would like to, in the history, you would like to rule out for danger signs, urinary incontinence, saddle anesthesia, these kind of things for ruling out what I treat. Alright. And then you ask the patient to lift it here, put it here, and then you will do like this. What is this? I am doing, this is called Faber test. have flex it, abduct it, and external rotation. This is causing pain in the sacroiliac joint. So if there is a problem in the sacroiliac joint, this should be tender. But this is this is a sacroiliac joint problem which will come positive when you do favor test in this leg, favor test in the other leg. Okay. So lower back pain, you need to know whether this lower back pain because of the radiculopathy, whether this lower back pain is originating in the hip joint, whether this lower back pain is originating in the sacroiliac joint or sacroiliac or is it originating from the quad equina. So lower back pain is a very big thing. So you make sure that this lower back pain, exactly from where this lower back pain is coming out. So lower back pain, you start off with the inspection, then you do palpation, then you do SLR, and then you do favor test, and you can do any extension of the hip joint, or you can do the whole of the movements at the hip joint, internal rotation, external rotation, flexion, abduction, adduction, and how are you going to demonstrate it, you can see in the other videos. That's not a problem. But now I'm here, I would like to focus on major things that are actually causing the lower back pains and how are you going to approach it. So that's another thing. Thank you.